Welcome to part 3 of our cloud-based clinical documentation system by CodoniX. Previous videos have demonstrated the ability to support an unlimited number of common procedures and exams, requiring nothing more than copying and pasting into a template generator. We've also demonstrated our occupational medicine solution, which automatically places orders based on the contract that was chosen and supports an unlimited number of companies, each with an unlimited number of specific contracts. We've also shown a streamlined telemedicine workflow, as well as the evaluation of a simple acute medical problem, a UTI. In this next video, we are going to focus on the many different existing clinical workflows that have been developed over the last 20 years of use. This is a brief introduction to the many clinical different solutions in CodoniX. We are going to show you how to evaluate soft tissue and anatomically specific problems, how to choose from over 1,000 different medical templates, support for standardized forms such as depression, alcohol use, etc., and finally, the many different ways to document physical exam findings. For this demonstration package, we've generated 2 patients in room 5 and 6 that have not been assigned to a problem and have not been pre-triaged. In the next series of screenshots, we will demonstrate multiple ways to document a patient. Once you have seen the video, click on one of these names and try your hand at documenting. There is one caveat. If you leave in the middle of charting and then come back to another computer or another session, you may see a padlock icon which blocks you from charting. This is because only one provider can document in a particular part of the chart at a time. To release the padlock, simply right-click on it and choose to unlock. Because no chief complaint has been entered, you are immediately brought to this screen. For soft tissue and anatomically specific complaints, click on the appropriate area of the mannequin. In this case, we are going to evaluate a laceration of the hand. You are immediately prompted to define the problem. Is this an injury, a medical problem like an abscess, or is this a recheck? These simple mannequins support more than 900 different anatomically specific problems. In this case, we're going to say it was an injury. Knowing that the problem is an injury, the application presents a number of problems that could be specific for the hand. For example, ring removal. In this case, however, we want to evaluate a laceration. You have now chosen a chief complaint and are ready to go to the general evaluation. You will be asked the mechanism, if known, and whether or not this is a job-related injury. These questions are all basically designed to optimally code the encounter, and you may or may not answer each of them. You are then brought to the all-purpose screen. Because the presenting complaint is a hand laceration, you are given the option to evaluate hand lacerations. Click on this link. You are then presented with a graphic of hands. Simply click over the area of the laceration. Not only does this automatically generate a very specific ICD-10 code, but it also loads the application with the appropriate risk management questions, as will be seen in the next series of screens. Clicking on the dorsum of the left hand brings up this screen, which not only supports lacerations, but other injuries which might be associated. For example, this could be due to an animal bite, or there might be surrounding significant abrasions, etc. In this case, it's a simple laceration. With 4 quick clicks, we've documented the anatomic location, the length, the complexity, and the orientation of the laceration, as seen in this screen. Because this is a hand laceration, the user is then prompted to document distal circulation and sensation. The next screen, which you're not seeing here, asks about tendon function. For example, if this were a laceration of the face or abdomen, these questions would not be asked. This emphasizes the power in customizing documentation to specific anatomic areas. These type of medical legal questions lead to much better documentation. By going down the columns, just going right down the columns, you can completely document the management of a wound in less than 60 seconds. An added benefit is that since the application knows the laceration coding rules and also knows the anatomic location, this documentation will also automatically and accurately assign the correct procedure codes. Here is an example of the output. This is a summary of the documentation. The history and exam have covered critical management areas. The documentation of the procedure is complete, including follow-up recommendations and the ICD-10 and CPT codes are automatically generated. In the next series of screens, we explore the diversity of medical solutions in CodoniX. In this sequence, we will look at the number of different medical workflows that are available in CodoniX. Although these are embedded in our urgent care primary care application, each of these workflows can be activated within any available URL. In other words, they can be embedded into any existing EHR. We will briefly examine the options under the Comprehensive list and the Common Simple list. Clicking on the Common Simple Medical list brings up this series of options. They range from scheduling a telemedicine visit to routine physical exams, follow-up appointments, and a number of common simple new problems. Each of these has a complete specific workflow based on the presenting problem. Clicking on the link Comprehensive List of all med search problems brings up this scrolling list. There are over 1,000 different workflows. You can double-click on one or several. In this example, we have chosen abdominal pain. Once you have made your choice, click Next, and you will be brought back to the main charting screen. Click on General Evaluation to evaluate abdominal pain. This screen is used to display various documentation options. Because the user chose abdominal pain, they are presented with two different workflows. Try out each to determine which you prefer. It's important to note that there are more than 1,000 of these optimized workflows that have been developed over 20 years of use. This returns us back to the main screen, and now we're going to look at a depression survey. This examines the ability to automate forms. In this case, forms are listed under the link to procedures. This link covers more than 350 common and not so common procedures, along with links to standard evaluation forms for things like alcohol intake, depression, and others. Double-click on surveys for depression, ethanol, mini-mental, ADL, etc. After choosing the depression survey, fill it out. You can then calculate the score, and you can print this survey. After printing, this form becomes a part of the permanent record. Next, we're going to look at multiple ways to do a physical exam. Click on the physical exam links. Many of the problem-specific workflows include problem-specific physical exams, but with the next series of slides, we will examine the multiple ways to document physical exam findings. One of our most widely used exam formats is the so-called quick-click exams. The user is presented with a two-dimensional table that allows for very quick and very specific documentation. Choose quick-click and then choose Next. You can rapidly generate a very specific exam. If you need to document even more specificity, click on Specifics. So you can see that the vital signs have been reviewed, the patient is alert, the patient appears to be comfortable. Now we're going to click on Specifics. Suppose you hear isolated rhonchi and crackles at the right base. Then you would want to document under Specifics that there are local findings. So click on Local Findings. This brings you to a mannequin, and you simply drag your cursor over where you hear the findings, in this case, the right lower lung fields. Since the application knows that you're in the right lower lung fields, it asks you appropriate questions. You are able to focus on very specific findings in the right pulmonary base. In this case, there was good air exchange, heard coarse rhonchi, and some expiratory wheezing. This is the output of the quick-click physical exam. Note the pulmonary exam, and note that the ICD-10 codes are automatically generated. By using a mannequin and documenting specific findings, a quick-click exam can become very specific while also generating the appropriate ICD-10 codes. There are multiple different ways to document a physical exam in CodoniX. Some are focused on things like a routine physical. Others go in depth for orthopedic or rheumatologic exams. The standard physical exam covers multiple organ systems. And by using two-dimensional pick lists and extensive use of graphics, it is easy, for example, to document a specific abscessed molar tooth or the exact location of a corneal abrasion. There are too many different specific solutions to demonstrate them all. We encourage you to explore. This ends Part 3 of our introduction to the multiple ways to document in CodoniX.